Good morning, everyone. Um, Today, friends, we are going to discuss a very important issue. Monsoon season is everyone's favorite. Yeah, we love monsoons, the rains. But some few tips which I will share from the point of gut, your intestines, your gastric issues, and liver health. How do we keep them healthy in this season? Okay. So important of this talk is divided into two parts. First, we'll cover the gastrointestinal illnesses and the liver health in the second part. It is a small talk. The talk is mostly kept open for your queries. I am just beginning it as a primer. So as we know, this rainy seasons, the most important problem of too many of the households are getting uncontaminated water. The water is mostly unclean because of a lot of sewage disposal problem and water pipelines getting contaminated because of rainwater seeping in. So this is the most common that clean water is not readily available to everyone. The second problem is now in rainy season, we have a lot of vectors, mostly this kind of flies, house flies, and they are the conveyors of mostly transmissions of many diseases which are spreading by fecal-oral route. So they transmit a lot of diseases. The other thing is our food habits and hand sanitization. Eating outside with this contaminated, unclean water, and again pose the risk to our gastric health, intestinal health, and liver health too. Of course, this season we love a lot of we have cravings. Our taste buds are on their almost for every food like these bhajiyas, chais, and samosas. So they are also mostly, if we are taking them from street vendors, they are from cooked from unclean water. And if taken in excess, they can also cause many other gastric issues like acidity and other problems, which we'll see. So mostly in this season, what we are seeing nowadays are this few types of food poisoning, which are mostly nowadays salmonella is very common. So we will talk in detail with about salmonella infection. The other infection which are common are E. coli. These are different bacteria. Okay, E. coli and salmonella are mostly more common in Mumbai nowadays. Other infections are which are by because of green leafy vegetables which are not washed properly, or if they are washed in sewage water, which many vegetable vendors do. So listeria is also common. Staphylococci infection is more common in non-vegetarian eating people, and mostly caused by uncooked, not properly cooked meat. Okay. So what we see is Salmonella, Listeria, Campylobacter. Again, because of undercooking of meat and undercooking of vegetables, it is also seen. Shigella is rarely seen, but botulism and Ciguatera is not seen in Mumbai. So what we see is mostly Salmonella, E. coli, Staphylococci, and some cases of Shigella. So we'll in detail see Salmonella because it is very common nowadays because of these reasons. Okay. So what is fecal-oral transmission? Fecal-oral transmission is any feces, human or say animal feces which are lying exposed. It gets somehow contaminated to our drinking pipelines or by to our food or uh, to our oral region, that is to our alimentary tract. So these are the possible vectors, mostly to house flies. Okay, they sit on these feces or say dirty surfaces which is contaminated by feces, and then they sit on our food and then we eat them. The other vector which can be directly possibly unwashed unclean hands, like I showed that pani puri wala and the street vendors, wherein they don't wash their hand often. This could be one mechanism. And again, the leakage of say, our water pipelines and sewage disposal. So Salmonella grossly can cause two types of illnesses. One is the traditional typhoid fever, which we all know, and the other infection what it causes is it causes salmonellosis, which is also called as food poisoning. It is a gastroenteritis. So what is the difference between typhoid and non-typhoid salmonella, which is also salmonellosis, is that salmonellosis is a mostly a gastric or intestine related illness. It causes diarrhea and mostly vomiting and abdominal pain, and it is caused mostly within say few hours of consuming any food. Say 12 to 72 hours of incubation period is required, and it doesn't progress to more systemic illness, say more dangerous multi-system illness. Whereas in typhoid fever, the incubation period is more than 1 week. So if you have eaten your food, the unclean food, unhygienic food a week prior, the incubation period of typhoid fever is 1 week. So it can cause illness a week later also, and it is more systemic illness, and it causes fever, high grade, and other organ dysfunctions also. So it is caused by Salmonella typhi, and this is called by other Salmonella, not typhoid fever. So what are the features of like salmonellosis? So salmonellosis, like this is non-typhoid salmonella, which is commonly seen nowadays in our region, is fever, abdominal cramps, and diarrhea. And it starts, like I told, within 12 to 72 hours of infection, and it usually lasts for 4 to 7 days. So 80 to 90% of these cases don't require hospitalization or antibiotic. They mostly settle on uh, hydration and good home food. Okay. It can also spread from animal to human hand contact. This is also most common region of spread nowadays in Mumbai, because most of the homes are having pets, because they go outside with these bare feet, and they bring a lot of unhygienic this thing to our. So hand washing, their feet washing is totally very important. Other common illnesses are, because I mentioned, unhygienic food supply, not proper washing of vegetables and all, and undercooked raw food, meat. Okay, so most of the cases settle with IV hydration, and in serious cases, we need admission in 10 to 15% cases, and we give them some kind of antibiotics, IV antibiotics, and it is easily treatable. It is not that serious of enteric fever. The other illness, which is called by Salmonella group of bacteria, is typhoid fever. So typhoid fever is a stage-wise illness. It has mostly 4 stages. So the first symptoms appears are like fever, fatigue, body pain, and headache. And later on in second and third stage, we have loose stools and crampy abdominal pain. So again, 50 to 60% of cases are mild typhoid fever, and they mostly require antibiotic. Almost all cases of enteric fever require antibiotic, wherein salmonellosis, not all cases require antibiotic. But in typhoid fever, all cases are treated with antibiotic, and there are specific sets of antibiotic which are given depending on the severity. So what complication can typhoid fever can cause? So the most of the complication of typhoid fever occur beyond week 3. The week 3, third week is the most important week while considering, if not treated early. So hepatitis, myocarditis, even shock, encephalopathy are the serious side effect of typhoid fever. And typhoid fever is not a mild illness; it is a grave illness, and it needs attention very early. So coming to these are the common GI illnesses nowadays. Uh, Gastric illnesses, we can say, intestinal illnesses. So one point which I would like to mention before going to liver health is, in all kind of acute gastroenteritis, which is common because of these pathogens, except typhoid fever, which will occur after a week of eating unhygienic food. All are treated with a good amount of hydration, home care food like home food, and good hand washing and hygienic practices. So very few cases require antibiotics. So don't directly jump over to antibiotics unless prescribed by your physician. So coming to second aspect, the liver health. The most common illnesses in the rainy seasons are two kind of hepatitis. So we have many types of hepatitis like A, B, C, D, and B and C are bloodborne, and A and E are hepatitis A and E are foodborne. Again, the mechanism of transmission is fecal-oral, and the symptoms are fever, extreme nausea, loss of appetite, sometimes fatigue, stomach pain, and in later cases, after a week, we get jaundice, what we call in lay language, and dark color urine. Okay, few cases may have joint pain too. Okay? So both hepatitis A and E have similar symptoms. Apart from these symptoms, I have mentioned like fatigue, fever, nausea, vomiting, dark color urine. We can have extreme itching because of yellow skin and eyes. Okay, so these are the symptoms, and both are having similar symptoms, except that hepatitis A is common in pediatric population, children's, and the hepatitis E is common in adult. These things. So again, the transmission of both the hepatitis is fecal-oral. So it is from sewage water, uncontaminated, contaminated vegetables, and they somehow reach to our gut and alimentary tract because of, say, flies or unwashed, not properly washed hands. Okay. So transmission, as I told, fecal-oral exposure to food or water. Food cooked by, if the food is cooked, if a person is suffering from hepatitis A and E, say street vendor, then if the food is cooked by him, not by proper washing hands, also then it is possible that you might get infected. Okay, that's how the human to human transmission is also there. A person with clean hands in sewage contaminated water, using serving you some kind of food, or says this is possible in cases of waiters who serves you in hotels. Okay, sometimes the virus is also alive in ice cubes. So if you are using commercial ice cubes, or say having drinks outside, then ice cubes may have hepatitis A and E virus. Okay, close physical contact, like sexual contact with the infectious person, can also cause human to human transmission. Okay, and of course, travel to high risk countries. India is a high risk country for endemic for hepatitis. Okay. So treatment of hepatitis A and E, again, it is not a specific treatment. Only what we do is we do monitor the liver functions. If they are rising beyond the alarming rate, and if there is dysfunction with the coagulation, the blood parameters, then only we treat. Most of the illness gets cured on their own, and the good news is you get a lifelong immunity of hepatitis A and E. So if you have a hepatitis A episode in your in one time, once in a lifetime, say in pediatric age, then you are lifelong immunized for A and E. So that is how we get immunity with one infection only. So taking rest is the utmost important during the phase of acute hepatitis. Due to nausea, you may not feel eating, but you have to keep your hydration to an optimal level. Very good level of hydration is required. So you can have a lot of fruits or milks and all. If you are hungry and if you want to like eat anything is okay during hepatitis, because there is nothing like that you need to eat less oil and all. It causes nausea. That's why people avoid it. But we recommend full diet if tolerated. Okay. Of course, you have to avoid alcohol consumption, tobacco smoking, and junk and processed food like carbonated beverages, cheese, and burgers during the phase of hepatitis. So how do we prevent? Prevention is like even using bottled water when the source of water is not known, like say while traveling in trains, you have to use bottled water to wash your mouth and hands and brush your teeth. So how does the virus is killed? It is only killed by boiling water for at least 5 minutes. 5 minutes of boiling water is required, okay, to purify it. And of course, using purified water, say RO water for washing vegetables, thorough washing of vegetables, and always during monsoon, don't eat raw salad and raw green leafy vegetable. Always cook them well and then only eat. And of course, hand washing is the key for avoiding all these illnesses. Alcohol-based hand rub is recommended to keep these viruses away. So again, I want to stress upon it. Only boiling water for 5 minutes kills the virus. Otherwise, all other practices are not documented to kill the virus. So if you are susceptible, say very elderly, having some liver disorders, already having some liver disorders, and pediatric populations during rainy season should use boiled water only. Prevention is possible for hepatitis A, but vaccine is not available for E. So, if you are a susceptible individual, I would recommend taking hepatitis A virus. It is available for both pediatric and adult use. Okay, two doses are required, 6 months apart, and then it gives good amount of immunity against hepatitis A. So hepatitis E can cause a fulminating liver failure probably in pregnant women. So I would recommend all pregnant women should only use boiled water during their entire pregnancy, whether it is rainy season or non-rainy season. HIV infection during pregnancy can even cause to intrauterine death, abortions, and high perinatal abnormality. So this virus somehow is more severe, you can say, in pregnant females. The other illness which affects liver and other system is leptospirosis during rainy season. It is transmitted mostly because of urine of rats. So the mode of transmission is mostly through your if you're having some kind of ulcer or cuts on your hand and feet, and if it is you are traveling through waterlogged area, say where the water is this thing, and Mumbai have a lot of this kind of rats and mice in their sewage. So their urine causes this leptospira. It is a spirochete bacteria. They are present in their urine and they transmit. And if you are having cuts like this and you are traveling in a waterlogged area, then you will have symptoms like fever, high-grade fever, rash, even jaundice in severe cases, sometimes vomiting, and even blood in your sputum. So these are the very late symptoms, but this could be a severe illness. If you are having cuts and like this and ulcers on your hands and feet, better to take prophylaxis. So leptospirosis prophylaxis is easy. It is given doxycycline tablet 200 milligram weekly, once in a week, and then you are protected for that week. So if you are planning to go to some waterlogged area, you have to start, or say farmers in mud. This can also transmit not only through waterlogged area but also through mud. Okay, if you are planning going trekking and all, then you should take prophylaxis of doxycycline 200 milligram once in a week till you are there in the exposed area. Okay, that tablet covers you for 1 week only, not beyond that. So this is also most common illness nowadays. Okay, so this is my final slide. What are the do's and don'ts during the rainy season? So what you can do is wash your hand properly with soap and water. If not, alcohol-based hand rub is available to everyone, but wash them thoroughly. Boil water during this kind of epidemics of hepatitis and rainy season, and boiling is recommended for 5 minutes. Avoid traveling to the countries where there is widespread hepatitis A. So the government CDC declares that there is epidemic of hepatitis A. But if the travel is not avoidable, then you have to take vaccine of hepatitis A. Drink clean drinking water, mostly bottled water or an RO water or boiled water if possible for everyone during rainy season at least, and take hepatitis A vaccination. What are the don'ts? It is, of course, no consumption of alcohol and smoking. Don't eat junk and processed food, and wash your hands, like washing hands not before eating. Irregular washing of hands is the most no. And avoid taking rest, like no proper sleep. So during hepatitis, you need proper 8 to 10 hours of sleep for your liver to regenerate. And eating food from street vendor should be avoided as possible, as much as possible. Okay, thank you. Enjoy your rainy season.